Good afternoon. It's a pleasure to me to be here to explain our experience or initial experience with the Diabeloop Accu-Check Insight system. Our hospital of Santa Creu i Sant Pau in Barcelona is one of the 4 public university hospitals in Barcelona. It's considered a reference center for high complexity, and the endocrinology department attend 1,200 patients approx with type 1 diabetes, and approximately 300 of them are currently treated with insulin pump therapy. So our experience with the system includes 26 subjects with type 1 diabetes that are now using this system for at least 1 month. And the indications to start with this with the Diabeloop mainly are the suboptimal glycemic control plus problematic hypoglycemia or patients that have very high glucose variability. The system is started within a structured diabetes program in small groups, usually 3 patients, and this program is run by nurse educators and consists 3 face-to-face sessions in the same week, and then at least 2 virtual or face-to-face sessions more or less 1 to 4 weeks later, and also virtual or face-to-face visit by the doctor between 1 and 2 months after a patient ends this educational program. The patients included in this study were 26, 20 women and 6 men with a mean age of 45 years old and a long diabetes duration around 23 years, and 17 of them were treated with multiple insulin injections and were users of flash glucose monitoring. 8 of them were treated with some type of different pumps and also flash glucose monitoring, and 1 patient came from a system with a predictive low glucose suspense. In summary, 25 of the 26 subjects were users of flash glucose monitoring, and these patients have a follow-up more or less of 9 weeks. Here you can see the results of this initial experience. We have the glucometric data provided by the previous system used, mainly flash glucose monitoring, and here you can see the results just before to start with the system and at 1 and at 3 months. Mean glucose is decreasing progressively, but this reduction didn't achieve statistical significance. But in the graph you can see how timing range increased a lot, because patients start with a mean timing range of 62%. At 1 month of the use of Diabeloop increased to 77%, and in the 3rd month this timing range is 82%. This means that an increase in 20% of timing range only in the 3 months of treatment. For me, it's also very important. You can see on the right of the graph the important reduction in glucose variability. Patients start with a coefficient of variation around 40%, and at the first month of treatment, this is only 27%. That is very good result. As you can see in the graph 2, we observe a statistical significant reduction in time below range of 70 milligrams per deciliter. Also a very important reduction in time above range of 180 milligrams per deciliter, from 23% before to start with Diabeloop, and 6% in the 3rd month of treatment. An important reduction also in time above range of 250 milligrams per deciliter, and also a reduction in glucose management indicator around 0.5%. It's important to see, and you can see in the next slide, the changes in the initial configuration of the system. At the beginning, we start with a standard target glucose for all the patients, 110 milligrams per deciliter. But in the first month of treatment, only around half of the patients maintain this, and in the 3rd month of treatment, only 11% of the patients maintains this glucose target. That means that 80% of subjects, or more than 80% of subjects, decrease or use a glucose target of 100 during the follow-up. We need to increase also insulin doses along the time, and also the parameters of aggressiveness in normal glycemia and aggressiveness in hyperglycemia. At the beginning we start with 100% of aggressiveness in normal glycemia, and at 3 months only 4% of the patients maintain this. The rest of the patients have aggressiveness in normal glycemia higher than 100%. And the same thing was seen with aggressiveness in hyperglycemia. Everybody starts with aggressiveness of 100%, and at 3 months, no patient maintain this. 100% of patients have an aggressiveness more than 100%. It's important to see that the patients, 65% of patients achieve the combined goal of time in range more than 70%, together with time below range of 70 less than 4%, just in the first month of treatment. So, in conclusion, the short-term experience in our center with a cohort of patients is that the system increased time in range, decreased time below range and time above range, decreased a lot glucose variability, decreased glucose management indicator, and the initial setup parameters require changes to be more aggressive, and of course longer follow-up will determine if these advantages of these good results or positive results are maintained in the medium and long term. And thank you very much.
Good afternoon. I will continue with our experience with Diabeloop in some particular patients. In this slide, there is my disclosure statement. Our first patient is a patient with extreme fear of hypoglycemia. She's a woman of 52 years old. She has hypothyroidism. She was diagnosed of diabetes 10 years ago. She has no chronic complications, and she had a bad experience with a hypoglycemic coma after initiating an insulin pump. And since then, she has extreme fear of hypoglycemia. She's treated with subcutaneous insulin analogs, and she has inadequate preventive measures of hypoglycemia. And overall, in the last 5 years, her lab hemoglobin A1C has ranged from 9.5 to 11.3, and we have seen no improvement after initiation of flash glucose measurement in 2020. Here we can see the summary of 3 months of her glucometrics with a glucose management indicator of 8.7 and glucose well over 200. This was at the expense of high and very high glucose levels with 0% low blood glucose. So she accepted to initiate Diabeloop, and it was initiated on the 7th of July. We did it with using very cautious settings with an insulin dose of 17 and an ideal blood glucose of 120. Here we have the results of the last 2-3 months. We can see how glucose, the mean blood glucose dropped by 42, the GMI indicator by 1%. And this was at the expense of especially very high glucose levels. The time in range increased by 28%, and with this, with a negligible increment of low blood glucose levels. The patient, most importantly than this, the patient feels reassured that hypoglycemia will not be a problem with the system, and even she has expressed that she is somewhat disappointed that glucose control is not tighter than this. Now we go to the second patient. That's a patient with extreme fear of hyperglycemia. She's also a female patient. She has hypothyroidism, long duration of diabetes, no chronic complications. And as to her glucose regulation, she is treated with multiple daily injections of insulin analogs. She has an extreme fear of hyperglycemia and experiences an episode of severe hypoglycemia very often, requiring a third-party help more or less every 2 weeks and a glucagon injection every 3 months. She performs inadequate modifications of her insulin treatment, titrating it higher, and her hemoglobin A1C in the last 5 years has ranged from 5.7 to 6.9, and the whole picture has been more or less the same after initiation of Freestyle Libre in 2019. We can see the summary of her glucometrics in the last 3 months. The average glucose was 116, the glucose management indicator 6.1, and which she had a nice time in range of 17%, but as high as 19% of the time below range. She accepted to initiate the Diabeloop system. It was initiated at the beginning of July, and it was initiated with the standard settings. And here we can see the results in these 2 months. We can see how the average glucose increased by 24, the GMI indicator by 0.5, the high glucose values by 5.0, but most importantly, the time in range increased 11% at the expense of a decrease of both low and very low glucose values. Most importantly, she has experienced no episode of severe hypoglycemia during this time. The patient agrees that overall the Diabeloop system is much better than MDI and plus Freestyle Libre in terms of hypoglycemia, but she also expressed some concerns that hemoglobin A1C has worsened. Now we go to the third patient. That's what I call the overwhelmed patient. She is 54 years old, has hypothyroidism after treatment for Graves' disease. She has a chronic demyelinating non-diabetes related polyneuropathy. Her husband had a sudden death some years ago, and this has had an impact on her diabetes. She has also a long-standing diabetes. She is treated for a long time with an insulin pump that was initiated pre-pregnancy. She has background retinopathy, and in this context, she has had quite high hemoglobin A1C values in the last 5 years. Diabeloop was initiated in May 19th with the standard settings. For this patient, we do not have a glucometrics of continuous glucose monitoring before Diabeloop. We can see the results of the last 3 months. We can see how hemoglobin A1C has experienced a nice decrease. We cannot compare the other metrics, but more or less they are quite reaching the goals. This would be an overall nice result, but I would like to give some further details. 3 weeks after initiating Diabeloop, these were the metrics. The average glucose was 186 and time above range 46. Of course, this was not so nice. And my comment was, you'll see how this gets better. And the patient answer with a big smile was that it would be okay even if it didn't improve. So my learning points from these patients would be that Diabeloop system helped to improve these patient situations. In the first patient, reassuring that the glucose could be brought down while minimizing hypoglycemia. In patient 2, reassuring that severe hypoglycemia could be avoided while limiting hyperglycemia. And in the third patient, reducing workload.